So I came across a post recently about a woman who traveled outside of the United States to have, I think, a BBL and liposuction and ended up having complications so bad she was hospitalized in that country for several months after her surgery. So I think this brings up some important topics that people really don't always appreciate or consider if they're trying to consider medical tourism and travel outside of the United States for surgery. So, as a board certified plastic surgeon, I myself would never consider having surgery outside of the US, and I never recommend it to my friends or family. That's not just because I am a surgeon in the United States, okay? There are many reasons why I think people travel abroad, but I think the biggest reason is for cost savings. They can have more surgery there for a lower price than they can in the United States. And I think that that is something should consider. Why is that? But not to knock international surgeons. There are some amazing world-renowned international surgeons. However, these world-renowned international surgeons are not cost-effective surgeons. They're not offering discounts. They offer a level of service, a level of expertise, and that is something that is not at a bargain rate. Okay, so the cost savings would go out the window. They also have wait lists that are months to years long. So this is not going to be a convenient, you can get it done ASAP type of situation. So the second reason why is that I think in the United States, we have some political unrest already at baseline. And this is a country we live in, and theoretically, we understand this country. So you're traveling to another country that you may not understand the political climate or any issues that are going on there. And if you're there for a week, okay, but if you're there and for several months because you're having a complication and you're stuck in the hospital, I think that's something that you should consider. Additionally, what is the healthcare system like in this other country? Do you understand it? Now, I know you have packages and you may understand the surgery center and the recovery house, but what if you have unplanned surgeries that need to occur? How are these being paid for? Are they going to demand payment before the possibly life-saving surgery is going to be offered to you? What are the qualifications of the surgery center? What are the standards that have to be met? What are the qualifications of the practitioners doing your care, like the surgeon? Is this somebody you meeting the day of your surgery right before your procedure, or is it somebody that you know and you trust and you've gotten to know over several weeks to months? Who's putting you to sleep? Is it a board certified anesthesiologist? Is it a CRNA? Who are the nurses? Who are the medical assistants? Who's watching you overnight in the recovery houses? So I think all of these things, lay people would not know specifically what qualifications are appropriate and not appropriate, especially in another country. So I think you don't know what you don't know, and for that reason, there's too many variables when you are in a vulnerable position trying to make a decision on where to have surgery. What is the liability of the surgeon or the medical team if there's a problem with you? In the United States, we have to have significant amounts of medical malpractice insurance. It's a very high cost that all surgeons have to pay annually. So what is the liability if there's malpractice or if there's an issue with your care abroad? Who would be accountable for that? And if there is an issue, how does your family get to you? How do they know that there's a problem? If there's an unforeseen surgery or transfusion or something that has to happen and you're incapacitated, who's making the decisions for you? So I think that these are things that generally people don't think about because plastic surgery is thought to be so beautiful and fun, and it is amazing, it's life-changing, but it is surgery, and there are very serious consequences and complications that can happen. So you need to have a surgeon who has high standards of practice and is operating in a facility that also has high standards and had to meet credentialing processes, as well as the team supporting that surgeon also has to meet those high standards. So I think that these are things people should really consider and take pause if you're considering traveling abroad for surgery. Another thing to think of is not all complications happen immediately after surgery in the first week or even the first 2 weeks. You could have issues like wound healing issues or infections that happen weeks to months down the line, and who's going to take care of those? It's not a good position to be in if you're anxious and nervous about what's going on with your body and not feeling well and having to try to get on the phone to another country to reach your doctor or a nurse over there. And it's very hard to find a plastic surgeon here at home that's going to take on a lot of the complications and disastrous issues we see from patients who travel abroad. Trying to find a nurse to pull out drains, or, I've even had patients get off of the plane and come to me with serious infections, coming straight to the ER with serious infections of their implants. So I think that you need to proceed with caution. In the United States, there are so many board certified, well trained plastic surgeons in your city, in your state, or in the neighboring states that you should find somebody who has the appropriate qualifications, is operating in a center that has the appropriate qualifications that you trust. And if there's an issue, they can see you within hours and days, and can really take quality care of you. So I hope that helps.